Taoiseach, the issues of access to mental health services, and specifically the total lack of access to residential psychiatric beds in Tipperary, is creating an appalling crisis within our county. Almost all of those who suffer psychiatric distress are forced to use the services at the 44-bed unit in St Luke's in Kilkenny. I want to remind you that on the 21st of December 2018, the Mental Health Commission issued summonses against the HSE as registered proprietor of the Department of Psychiatry, St Luke's in Kilkenny. Then on February 19, Kilkenny District Court found against the HSE on a number of charges relating to breaches of the 2001 Mental Health Act. St Luke's Hospital pleaded guilty to 4 charges, including poor maintenance of seclusion facilities and failure to comply with the rules governing signing of the seclusion register by consultant psychiatrists responsible as required by law. The Mental Health Commission inspectors report, and I apologise for this last caller, that they were almost physically sick from the smell of the discarded colostomy bag, which had been left in a clinical waste bin inside the room where electric shock treatment is administered. It's appalling. Quite frankly, this is deeply offensive to the dignity of all patients, wherever they come from. Was anyone held accountable? Of course not. Judge Brian O'Shea fined the HSE a paltry $5,200. What signal does this send out to the families of the service users? More importantly, what does it do to meet the overwhelming need for residential psychiatric beds within our county of Tipperary? Each year, since the closure of St Michael's unit in Clonmel, the situation has continued to deteriorate rapidly. I accept the bona fides of Minister of State who's here, Jim Daly, and sincerely accept what he's trying to do. But something is blocking the return of psychiatric beds to our county of Tipperary, and it needs to be urgently addressed. Urgently addressed. It's way beyond time. Added to the crisis in the provision of adult mental health services, it is even more alarming crisis. There is even a more alarming crisis in the child and adolescent mental health services CAMS. There is not a single senior register for either CHO Area 3 covering North Tipperary or CHO Area 5 covering South Tipperary. There is not one full-time CAMS speech and language therapist assigned to South Tipperary. It's appalling. Nor is there a single CAMS social worker assigned to South Tipperary. When you put all of this together, Taoiseach, it is clear that we are beyond breaking point in Tipperary. The HSE indicates that the South East Community Healthcare area has the second lowest rate of acute psychiatric bed provision. If this area were to be provided with the national average rate of bed provision, an additional 18 acute psychiatric care beds would be required. I do want to acknowledge the announcement that the National Centre for Youth Mental Health have announced that they plan to add to their growing network the new services in Tipperary earmarked for 2019 or early 2020, and we're waiting for that. In the meantime, however, the provision of professional and additional residential psychiatric services in the county is at an all-time low. What steps are you and your government, Taoiseach, taking to address this very urgent matter?
Taoiseach, 3 minutes.
I want to thank Deputy McGrath for raising this important issue. I'm afraid I don't have an up-to-date note in front of me on the particular issues you raised in Tipperary, but I did read about the coverage. I read the coverage of the events that you mentioned at the time, and I have to say I share your revulsion at the fact that basic things like patient care and hygiene were not tended to properly in that unit, which is a relatively new unit, and there's no excuse for treating patients poorly or poor hygiene. These things do not require massive resources. They just require people to do their jobs and do their jobs properly. I'm sure that the HSE will respond to the Mental Health Commission's report and make sure that remedial action is taken and changes are made. The focus in mental health over the past 10 or 15 years has been the right one in my view. It's moving away from inpatient services to outpatients and community services, moving away from the traditional model of mental hospitals and psychiatric institutions to care in the community. And that is much more appropriate in my view and is the right way to go. And you'll know in Tipperary, for example, a new jigsaw service is being established to improve services available to people with mental health issues in the community. There is also increased capacity in primary care. 114 new assistant psychologists and 20 psychologists have been recruited by the HSE primary care unit, most of them now in place. There's an increased supply of psychiatric nurses with funding for an additional 130 undergraduates per year. 10 advanced nurse practitioners and CAMS services are currently in training. Minister Daly has developed a mental health telephone line which helps to signpost people to the support they need, particularly out of hours. And you'll be aware that the budget for mental health this year will approach €1 billion, the biggest budget for mental health ever, with 55 million set aside for improvements in services alone. And also, while there's been a lot of focus, as you know, on the National Children's Hospital, I know you're particularly interested in that, we shouldn't lose sight of the fact that there are now 3 new hospitals under construction in the country, one of those being the National Forensic Mental Health Campus in Portrane, which will replace the very outdated Victorian facilities that exist currently at Dundrum.
I don't believe Tipperary and their families will take much solace from your answer. On the 11th of May, over 10 months ago, your colleague Minister of State Jim Daly wrote to the Chief Officer of the CHO5 outlining the need to restore some acute bed provision for adults in Tipperary following the closure of St Michael's. Taoiseach, we just cannot manage without these beds. The Vision for Change, you said, is working. It's not working. In its 2 years over its report date of 10 years now, it has been a disaster for Tipperary. And it's a black hole instead of a vision. And you can mention the Children's Hospital all you like. We'll see what that ends up as well. But people don't have the services. They can't get access to Kilkenny. And not that they're not wanted there, but they're not enough room in Kilkenny to deal with the Kilkenny-Carlow situation, not to mention the appalling vista that we mentioned there. So look, there clearly is no services in South Tip and very little in North Tipperary either. To be sent to Kilkenny and Innis from North Tip is just an appalling vista. And you cannot allow this to go on. Long-stay beds will have to be reinstated in St Michael's or some other place. We don't want every building like St Luke's and Clonmel, former psychiatric, and St Michael's covered up with offices and storage. We want facilities for people to go. Nurses and people and clinical advisors are burnt out here, psychologists now trying to deal with this issue. And unfortunately the patients, many of them are ending up in their graves, and it's just a terrible indictment on your government and the Vision for Change and anything to do with it.
Taoiseach to respond is 1 minute.
Thanks again, Deputy. Just in relation to the particular case and the particular facility that you mentioned earlier, I'm advised that the HSE has accepted the Mental Health Commission's report, has put a plan in place to deal with it, and funding has been allocated to implement it. But once again, I need to emphasise that patient dignity and basic hygiene doesn't require much resources, and there should be no excuse for treating patients with a lack of dignity, and no excuse for basic hygiene standards not being followed. I can't comment on the specific requests that you make for additional inpatient beds in Tipperary. As I've said before, the model of care that we're moving towards in mental health is away from mental hospitals and psychiatric institutions towards community care, and by and large that has been the right policy direction. But Minister Daly, who is the Minister responsible for mental health, has committed to meet with the Tipperary TDs to discuss this matter in the coming weeks, and I'm sure you'll use that as an opportunity to put across your suggestions.